And thank you for joining us. With us is Dr. Garrett Britton. Doc, good to see you. Thank you for being with us today.
Thanks for having me, Luke.
Before we get into what you do here at Meadville Medical Center, let's take a step back. Where did you grow up?
Yeah, so I'm a native. I grew up in Townville originally, not far from here. I was actually born in Meadville Medical Center.
That's fantastic. We'll have to come back to that here in just a minute, but what did you do growing up? What were you involved with?
Yeah, so growing up, it was very sort of outdoorsy childhood, hunting and fishing. We lived in sort of a very rural part of Crawford County. Went to Maplewood Elementary School and high school, and I spent some time working at some of the local tool shops here.
That's great. At what age did you know that this is the direction you wanted to go? Medicine was the thing for you?
Yeah, so actually growing up, my mother worked for a local general practitioner and then later for Orthopedic Associates in Meadville. And so growing up, I sort of had exposure to medicine and sort of the healthcare system here. And I think that's sort of what drove me into this direction.
So the older you got, the more you said, boy, this is the direction, this is what I want to do.
Yeah, for a little while there, I was very interested. I worked for a local tool shop doing tool and die, and that was in 2008 when the economy sort of tanked, and that sort of changed directions for me. So I kept on my sort of college career, went into medicine, and later a military career.
That's great. Let's get into that. But before that, I was just thinking of some of the similarities. Using your mind, using your hands in the tool shop, that can also apply, obviously, in medicine.
Yeah, that's a very interesting observation. So, once I got into the later part of my training, my critical care fellowship, I think some of that sort of tool and die expertise sort of came into play. With sort of understanding geometry and some of the precision with some of the procedures that we do, I relied on that background.
Military, let's go into that. How did you get into the military?
Yeah, so, growing up, I always, wanted to join the military. There were several times out of high school that I almost enlisted in the military, and, my parents sort of encouraged me to just wait a little bit, keep pursuing my college career and see where that would go. And it was after I received my acceptance letter to medical school, that very next day I went to the local recruiter and took a commission in the United States Army.
Well, first of all, thank you. That's fantastic.
Appreciate that.
So let's kind of tie in some of this, the early education and getting through medical school, tie everything together, because now you're in the military. What are you doing in the military?
Yeah, so, I went to University of Pittsburgh. I started at University of Pittsburgh at Titusville. I did several years there, and then at University of Pittsburgh at Johnstown. And then after I got accepted to medical school, I went to LECOM, Lake Erie College of Osteopathic Medicine. It was during that time that basically I was in the Army Reserves. And so it did a small amount of time, some training down in Texas with the military, but primarily focused on my medical education. After graduating from medical school is when I went to active duty service. I was accepted to an internal medicine residency program in Augusta, Georgia at Eisenhower Army Medical Center. And that's where I did my 3 years of internal medicine residency training.
Wow. What did that experience lead you to? Where all did you go after that?
Yeah, so that was a very, as I look back, I was very fortunate to train there. I was exposed to a variety of healthcare conditions, a variety of healthcare settings, from outpatient clinics to, very critically ill patients in the hospital, at multiple hospitals in the Augusta area, which is a very large sort of metropolitan area. And it was that experience that sort of drove me into the critical care, my interest in critical care and that part of my career.
It seems like the experiences that you had have really shaped who you are today, and that led you coming back to this area. How important was that to come home?
That's right. So, it was always my goal, pretty much from the day I left the area to get back home. And I wanted to bring as much experience and expertise back with me, to the area. Meadville Medical Center has always been sort of a benevolent organization. Community is very important. That was a big part of my upbringing, is the sense of community. And I think, as far as healthcare systems go and as far as hospitals go, Meadville Medical Center is, one of the more benevolent, organizations, and they recognize the importance of community.
So let's talk about your expertise and what it is you provide the folks here in Northwest Pennsylvania.
Yeah, so when I left the military, I did 9 years of active duty service, and when I came back home, the last several years of my practice had been primarily as an intensivist or a critical care physician at the Army Burn Center in San Antonio, Texas. And so coming back to the area, my goal was to be engaged in the care of critically ill patients. So I wanted to return to an ICU, but recognizing that, that need may not, be here immediately. So, when I approached the hospital, basically I told them, I have a background in internal medicine and critical care, and however I may be utilized, I'm happy to serve in that capacity. And so, this opportunity was available in the field of perioperative medicine. And so, they sort of plugged me into that, and it's been almost a year now, and I think going very well.
For those who might not be familiar with what that is specifically, talk a little bit about that. I'm sure people have heard that term, but what does it mean?
Yeah, so, perioperative medicine is not a specific sort of board certification. There's not necessarily specific training, but rather a concept. As patients, are living longer with multiple healthcare conditions, with maybe more severe healthcare conditions, we have recognized the importance of including a medicine doctor in the care team between a surgeon and the anesthesiologist. So my role on the team is to see patients before they have their surgery, to assess them for their various healthcare conditions, and to make recommendations or adjustments to optimize the patient prior to surgery so that they can have the safest surgery and the best possible outcome.
It's maybe strange to think that you do need to check on the health of the patient before being operated on, because that's very important.
Yeah, I would say that's sort of the most important period, of the perioperative period. So, there's sort of 3 phases. There's the before phase, there's the in-surgery phase, and then there's the after-surgery phase. And, I think that preparation and planning period is the most paramount to having good outcomes, reducing the risk of complications during and after surgery.
And there are people that think, okay, maybe I went to the ER, I need to have this operation, and I'm going right in. And I'm sure emergency surgery, that might be a little different, right? But in this case, you're talking about a patient who is being presented, okay, here's what we need to do. Now we need to make sure that you're able to make it through that operation. And that's where you can kind of come in and say, okay, let's go through and look at the patient.
And that's a wonderful observation. And as I sort of do this job a little bit longer and reflect on my past practice at the burn center, when patients came to us at the burn center, severely burned, they had to have surgery. And many times it was sort of an emergent surgery. So we didn't necessarily have time to go through the things that we do, with these other patients, prior to that. But some of my practice there was involved in the care of patients who did not have to have emergent surgery. So maybe a patient has a more severe burn, but it's not critical. And so we have some time to, review their health conditions, maybe do some preoperative testing to try and optimize the patient. And the more I do this job, I realize that experience has, lended itself to my current practice here.
So talk about just some of the patients that you would see, maybe some of the situations you encounter, and just walk through some of those scenarios.
So currently, a vast majority of my practice is involved in patients undergoing orthopedic surgery, knee replacement, hip replacement, shoulder replacement, and spine surgery. And so these tend not to be sort of emergent or critically ill patients. So we have time to meet with the patient, discuss their health conditions, and make some recommendations, and maybe tune those health conditions before going to surgery. I think it's important to understand that patients with osteoarthritis or degenerative joint disease, spine disease, that really is a whole body disease, and many times it corresponds with other health conditions. Things like high blood pressure, things like diabetes and obesity tend to increase the risk for developing some of these orthopedic conditions. And so a vast majority of our patients undergoing orthopedic surgery have many of these comorbid illness or corresponding diseases. So typically what happens is, when one of our surgeons meets with a patient and decides together that surgery is the best option to treat their disease, the patient then comes to see me. And what I do basically is meet with the patient, discuss their past medical history, their past surgical history, discuss what medications they're currently taking, and make recommendations on what to do with those medications before surgery. Many of the medications that patients take don't interact well with anesthesia, and so if the patients continue to take those, that can increase their risk for complications during and after the surgery. The anesthesia that we give, as good as it is in 2024, still is not without risk. And so there are certain health conditions that we have to pay attention to and maybe modify prior to the patient having anesthesia.
That's completely fascinating. At what point are you brought in? Is the patient asking for your services, or are you working with those teams of doctors that are coming in to, decide whether you need a knee replacement or hip, whatever it is on the orthopedic side, for example? Are they bringing you in for that? How does that process play out?
Yeah, that's a great question. So long before my arrival, Meadville Medical Center recognized the importance of embedding a medical doctor in this process. We tend to be, I think, a higher volume center for doing these surgeries. We have some very skilled surgeons here. We're very fortunate to have the program that we do here. And so Meadville Medical Center years ago recognized that we need to have somebody basically embedded in this process. So much of my week is spent here at Vernon Place at Orthopedic Associates of Meadville. And as the patients are seeing their surgeons and the orthopedic team, once they decide that they're going to have surgery, I'm available to meet with the patients many times on the same day that they meet with their surgeon.
So really, it's getting them prepared for the other doctors and their expertise, so everything is sort of fitting in place. We've done a lot of conversations, just the aftercare. But you also need to have that pre-op care as well, and you're getting that with what you do.
That's right. Yeah, like I said, in my opinion, that's the most important part of it is selecting, patients who are sort of healthy enough to go through surgery, and then the ones that have, maybe more severe health problems that are going to increase their risk for surgery. Not telling them no, that we're not going to do surgery, but that we need to make some changes, that maybe we need to do some testing before surgery so that we can get them through that surgery. We recognize that joint disease, that spine disease is very debilitating. And when patients become debilitated, that a lot of times creates sort of a vicious cycle that can worsen their other health conditions. You know, we see patients gain weight, maybe their blood pressure goes up, maybe their diabetes get worse because they're not able to exercise, they're not able to get out and enjoy the things that they do, and so there's a psychological and emotional aspect to all of that. And so, you know, we recognize the importance of pursuing these treatments in that these disease processes are whole body.
And this may be way off base, but I think of those pharmaceutical commercials you see on TV where out of the 60-second commercial, 40 seconds of it is here's the side effects. I see you as the guy that's coming in to work with the patient to say, this is how we're going to eliminate all these things so that this thing does work for you.
That's exactly right. No, a lot of these medications, like I said, interact with the anesthesia, increase the risks of surgery. The surgery itself and the anesthesia has its own risks, and my job is to minimize those risks.
It sounds like it's a very busy profession.
It is, yes. We're a very high volume center. I think we are a very specialized center. You know, our surgeons have additional training and specialized training in the surgeries that they perform, which lends itself to very good outcomes. You know, when we sign patients up for surgery, we are very confident that they're going to do well. They're going to have an uneventful recovery and get back to doing the things that they want to.
And I think when patients hear that, you know, why it's so important for the hospital to have that level of excellence, this is just another step in that process to make sure the patients are safe and that the outcomes are to the highest level, you know, quality as possible.
That's exactly right. You know, we do not want to do anything, that may harm our patients, right? We want to give them a better life, to restore their function, to whatever activities they were doing before, and not minimize that risk of complications.
Absolutely. We spent a lot of time talking about the orthopedic side. Other parts of medicine here at Meadville that you provide your services?
Yeah, that's a great question. So, in addition to patients undergoing orthopedic surgery, we also see patients undergoing other types of surgery. We're trying to expand our services because we see the impact on being able to do more surgeries by having patients optimized and I think having better outcomes after surgery. So in addition to the orthopedic surgeries, we also take care of patients undergoing foot and ankle surgeries by our podiatric surgeons and patients undergoing ophthalmologic surgeries like cataract extractions and things like that.
Which is, again, something that people may not be thinking about, but any type of surgery, there's always that cause and effect, right? So what you're doing is coming in, providing your services to optimize that whole experience for the patient.
That's right. And the other thing I'd like to say is that, before the concept of perioperative medicine, a lot of this was already being done by the patient's primary care doctors. But a lot of times what we find is that, a patient may need to have surgery more urgently, and they aren't able to get in to see their primary care doc to have the workup. And so, we sort of provide that opportunity or availability. Patients certainly are welcome to see their primary care physicians, to have these things done. But a lot of times they're very busy. They're taking care of vast amounts of patients in the community, and they're very, very busy.
I want to kind of go back to your military service. If somebody came across your bio, they'd be very impressed. Let's talk about Walter Reed and some other experiences you had while serving in the military.
Yeah, so I was very fortunate to be able to do my critical care fellowship at Walter Reed National Military Medical Center in Bethesda, Maryland, which is sort of known as the President's Hospital. So when the President gets sick, that's where he goes or she goes to get their care. And so I had wonderful training in the DC area. I was able to spend time at multiple hospitals with cutting-edge technology, cutting-edge procedures to take care of critically ill patients. And I think that experience helps me to take care of patients even in this setting.
And that also led to some other pretty unique experiences working with burn patients. Talk about that, because you did do more than just what you talked about in DC and in Texas. You were around the world a little bit.
Yeah, that's so I spent 4 years at the Army Burn Center in San Antonio, Texas, and in addition to being the Department of Defense's burn center, so any DoD personnel that was burn injured would come to us, and a lot of times we would have to go to them. And so, in addition to being at the burn ICU, I was also lucky enough to be part of the burn flight team, which has a long and prestigious sort of history behind it. The burn flight team sort of stands ready 24 hours a day to deploy anywhere around the world to retrieve burn injured patients. And so, I was fortunate enough to be involved in some of the missions. I was able to go to Kuwait to pick up a burn injured airman. Basically we spent 4 days in a military medical transport, air transport, flying to different countries, trying to get to Kuwait, and then bringing that patient back, and had a very successful outcome in that case.
Doc, you've had experience traveling the country, the world. We've been with other guests who love the outreach part of it. Is there an opportunity for you to provide outreach while still being here?
Yeah, that's a great question. So I do have a background in telemedicine. One of my big interests is telemedicine. I think there's a big potential there to increase sort of the reach of medicine, through technology. And so I think something that Meadville Medical Center is interested in exploring is application of telehealth. In 2000, I deployed to Guam as part of a FEMA COVID relief mission. Guam was stricken, as many areas were by COVID. Many critically ill patients in sort of under-resourced hospitals. And so I deployed there as a critical care physician for 6 weeks to help offload some of the work from the docs and healthcare providers there. And we had a very great experience there. And when we left, we were trying to figure out a way to keep in touch, to support the people at Guam Memorial Hospital. And we stood up a tele-critical care program, which I continue with today. And so, basically I help provide critical care to the hospital there from Pennsylvania.
Wow.
We're able to log in with some of the hardware and technology that we have to see the patients, to interact with the nurses and therapists and other docs there. We can have family discussions, with the patients and their family members, live through these devices. And I think we've had a very favorable impact on the hospital. I think a lot of that technology can be utilized in this area. We have folks that are in areas, in regions that are maybe more isolated. Maybe it's harder for them to get to the hospital. Maybe they have debilities that limit their ability to, get out of the house and get to their doctor's office regularly. And so I think there is a strong potential for telehealth to fill some of those gaps here.
That's fantastic, and thank you for doing that and putting that effort forward, because that's in addition to what your duties are already here at the hospital, correct?
That's right. So sort of because of the time difference between us and Guam, I'm able to do that at night and not interfere with my day-to-day operations at Meadville Medical Center.
It's amazing. Technology's changing, the world is changing, but I'm sure with, again, your background, the the world's a small place. We're all in it together, aren't we?
Yes, we certainly have sized it down, increased our reach, with this technology.
Do you ever smile as you're driving home and going through beautiful fields and just knowing that you're making an impact here locally, but also in another country?
Yeah, that's an interesting thought. Sometimes it's easy to get lost in the day-to-day activities. The burden, the healthcare burden can be heavy sometimes, and I think it's sometimes easy to lose sight of what impact we're having and what we're doing. One of the things that I most appreciate about this area and the patients here is that they're so grateful. I can't tell you how many times once a patient gets through their surgery and they're back to doing their activities. I had a lady recently, she was 90 years old, and what she enjoyed doing the most was cutting her grass. But because of severe hip disease, she hadn't been able to do that. And so she saw Dr. Gebhardt, she saw us, she had a hip replacement, and several weeks later, she was back to mowing her grass and happy as could be.
From people wanting to cut grass to getting back on the grass playing golf, it's all part of the process.
That's exactly right.
Well, again, thank you for your service and taking care of our soldiers and being there to do all that. That's incredible.
Appreciate that.
Coming back home, that's got to be nice for you. What do you do to relax at the end of the day?
Yeah, so the last 9 years in the military, we were largely stationed in sort of metropolitan areas, and growing up, it was in a rural area. It was sort of difficult to spend all that time, in the city, and so, my wife and I have two young boys. We wanted to get back home and get back to the country, as it is, and so we try to spend as much time outside as we can. We raise some chickens. We have several dogs, and we try to spend as much time outside as possible.
Boys have hobbies?
Yeah, so they're involved in sports. They do soccer. They do karate. I think what they most enjoy is sort of being outside, hiking, camping, and chasing the chickens around.
That's great. Probably a little Rocky moment there, right?
Yeah.
Any favorite books, movies, music?
Ooh. Growing up, I actually played bass guitar in a band.
Okay.
We always thought of ourselves as a Tom Petty cover band, and so sort of that classic rock. And it's funny, in Texas, country music's sort of the big thing. And then when we come back home, it's certainly a big thing here, but that 94.3 classic rock radio station was good to get back to.
Well, Dr. Garrett Britton with us, and I know he won't back down from helping his patients, and hopefully you learned something as well. Doc, thank you so much for your time.
Thank you,
real
Luke.
pleasure.
Appreciate it. Thank you.
And thank you for joining us as well.